Endometriosis is a condition whereby the cells that produce periods, normally they are in the cavity, the inside of the uterus, go to other places. So you find that they can be anywhere next to the uterus, they can be in the ovaries, they can be in the intestines. And endometriosis is a very, very complex problem because even those cells can go to the brain and go as much as the chest. So you'll have such a person having those cells that are normally occurring in the uterus, inside the cavity of the uterus, going to other places and causing problems there. So it's a condition where you have the normal menses producing cells, we call them endometrial cells, being in other places apart from the cavity, the inside of the uterus. The problem of endometriosis can affect anyone in the childbearing age. It starts a very, very common condition in the adolescents and it can go on until menopause time. So it's a condition that affects all women in the childbearing stage. The commonest sign of endometriosis is pain, cyclical pain, that whenever these women have endometriosis, they'll be complaining of severe, sometimes moderate pain from just a few days before their menses, and when their menses arrive, it continues until the menses are over. So pain is the commonest symptom of endometriosis, and this is something to be addressed. The other problem that those women can have is abnormal bleeding. Abnormal bleeding is another sign that the women with endometriosis can complain. But as I've said, and I would like to emphasize, pain, chronic pelvic pain. Many times it goes undiagnosed, many times like the adolescents, I'd like to mention the adolescents because it's a common problem amongst the adolescents. The little girls who come, they're in school, in secondary school, they're just complaining about pain. You pass it on and tell them, oh, look at this is part of growing up. There's no pain that is part of growing up. It should be addressed. And endometriosis, we should have a high index of suspicion to try and rule out endometriosis because chronic pelvic pain is the most common presentation of endometriosis. And then you can have abnormal bleeding, and then depending on where the endometriosis is, because as we defined, we say it is cells that are supposed to be the uterus that go to other places. So if they go to the lungs, some people have complained of a cough that has bloody, you cough out some bloody substance. If it goes to other places, like say the urinary bladder, they can urinate some little blood. It can go to other areas that the private part will have some nodules of blood. So depending on which other organ it affects, then you have presentation according to that organ. But by and large, the commonest problem is chronic pelvic pain and abnormal uterine bleeding.
Yeah.
Endometriosis, you must have a high index of suspicion. You must think of endometriosis. Wherever you have an adolescent, a woman in childbearing age having chronic pelvic pain, a pain that comes with the periods, a pain that comes on and off, you must have a high index of suspicion. That is the first most important thing. Secondly, you can do an ultrasound, and if you have some growths, some endometrial cysts near the ovaries, or some other abnormal growths in the pelvis and other part of the abdomen, then you can think about endometriosis. You can also do an MRI, magnetic resonance imaging scan, which is a higher scale than ultrasound. It can also try and pick some growth of endometriosis. Many times, you may do all those tests, but you do not get endometriotic. You may say normal, but the patient or the adolescent or the young woman or the whatever woman in the childbearing age is suffering from that chronic pelvic pain. Then from there, you can decide to have a challenge of some medicines that we normally use for endometriosis. But the commonest again is the history, the sign, or the high index of suspicion, the ultrasound, and the MRI. Again, if you still are convinced and you're not able to get, then you can do a surgery called laparoscopy. Laparoscopy is a surgery, a high-tech surgery that looks at the inside of the woman in the pelvis and the abdomen, and it is able to pick the characteristic endometrial findings in the woman's pelvis or abdomen. But that one is normally a last resort if you think you cannot get from the history, from the ultrasound, or from the MRI. I'm Dr. Wachira Murage, an obstetrician and gynecologist working at Savannah Healthcare Services. Visit our website www.savannahhealth.co.ke to learn more about Savannah Healthcare Services. Also subscribe on the YouTube on this channel and be able to learn more about us. And we kindly ask you to comment on the comment area about anything that you want to say, and also any requests of any topics or any queries you want addressed.